Hey, how's it going, everybody? I'm Matt Bisaccio here for WMCT, WMCT Sports. Today, we're joined by Major League Baseball shortstop, 9-year vet. He played between the Reds, the Diamondbacks, 5 years with my New York Yankees, and last year he played the 2020 season with the Philadelphia Phillies. I'm joined by Didi Gregorius. Sir Didi, my apologies. How's it going today?
Good, man. Thank you for having me.
Not a problem at all. Very blessed to have you come on here, and you want to spread your, your information about this new trial that's going on. It's convalescent blood treatment. Can you just tell me a little bit about what you know about the treatment itself and how you got into it?
I'll go with how I got into it. Since I'm one of the few people that have a chronic kidney disease, and we partnered up with the Johns Hopkins University to talk about what they are doing, and they came out with the plasma trial that they were doing. So I think if you want to have more info about it too, you can get on covidplasmatrial.org, and it's something really great that they're doing, because everybody knows a vaccine is already out there, but it's not gonna get to everybody at the same time. So I think this is like the in-between step, to prevent like further illness down the road. So like people like me or other people, get to the hospital, prevent them from going to the hospital, something like that. So I think it's something really great that Johns Hopkins is actually doing.
Yeah, it's supposed to be a treatment that basically, when given to somebody in the early stages of their positive test, will start to bring down some of the symptoms and stuff like that, and really start to limit some of the people that are being admitted into these hospitals. They're so overcrowded right now. Yeah. You said that you have that chronic kidney disease, and you're one of the few Major League Baseball players that I remember really seeing that wore the mask all throughout the season itself. Now, for somebody that played a little bit of sports, not really much compared to somebody like you, but how was it having to wear the mask throughout the entirety of the season? Was there ever any consideration like, wow, this might affect my play, or like trying to round the bases? Like, did you ever think that maybe on a hot night it might interfere with your play at all?
No, for me it was more, this is something bigger than baseball. This is your health you're talking about, because if you screw up with your health, you can't play baseball. So the only way you can play baseball is by taking care of yourself, So I think that's why I was wearing the mask, and the Phillies had a really good way that they were going about it, So they made the rules and all that stuff. So like once you were inside, you always needed to wear the mask, keep your distance and all that stuff. So even to change the locker rooms a little bit with spaces in between. So they did a really great job, putting that out there so people understand what's going on. But once you were outside, on the field, it's 50-50. You can wear it or not. It's up to you. But at me playing shortstop, I talked to guys at second base. So that was one of the reasons too why I always had the mask on. It's like I take it off to wipe my eyes or something, or nose or something like that, but I put it back on, so.
No, that makes total sense. Another part of why you're here today is that you want to try to take away some of that negative stigma associated with people that have tested positive. Now, so what do you say to those people that have tested positive for COVID, and like what do you want them to do? What do you say to that person that wants to maybe get involved with this trial program?
Like for me, what I think personally, you shouldn't feel like ashamed or guilty. I think that's the main thing, because people think, oh, I won't get this, and once they got it, well, I don't want to tell people that I have COVID, so I'm just gonna be idle for 2 weeks or something like that. So for me, it's just like, if you have it, this trial will actually work. So once you have it in the first, I think, week or so, in the early stages, do the plasma and see if it works for you. You got to be, I think, if I'm not mistaken, 18 years or older to do it. So I think that's the first steps, because it prevents, further down the road something that can happen. So it helps you and people in the community, because the quicker people we can get rid of this. It's been a year now. I think I can speak on everyone's behalf. We miss that normalcy that we had before, So I think that's the thing that we try to get rid of.
No, for sure. And hopefully through what we're doing right now, you can help spread the word, and people start to think to themselves like, man, I really need to get out there to really try to make a little bit of a difference, even through a difficult situation like testing positive. It's a tough thing for people to go through. But
exactly. You're right.
Absolutely. But aside from just like the COVID and the treatments, what were your general impressions on the 2020 season? Now, you had a pretty decent year. You played in all 60 games, if I'm correct. You had 10 home runs, 40 RBIs, and you hit, I think it was like a career second best, like 284. You know, was it strange for you, like really having these games in stadiums that had no fans? And what are your thoughts on the year in general?
You know, it was a little bit different, but you know, like I said, like we playing with the cards that we were dealt with, you know. So every major sport is dealing with the same thing for the first time. So and you know, they manage the best way they can to help us have the season completely. So I think they did a really great job with that. And you know, it all depends on the organization because certain teams run things differently. So it helps you to know what's going on from the beginning and get more info on, and for you to have like a successful season. And that's how we went for 2020.
Sure. And one last quick little thing. What would you think of some of the new rule changes that were implemented, like the 3 pitcher minimum, and then what was the other one? Oh, in extra innings, of course, where you throw the runner on second base. But what did you think of that? Do you think that that's something that they should keep, or do you think it's a little unnatural?
I mean, the keeping the extra runner, like putting the extra runner in base in the extra innings, you know, that was different because I actually played like that in 2010 when I was playing with a Dutch team. You know, we represent Netherlands, somewhere like, and that's how they do it. So whenever a team is tied or something, you go to extra inning, everybody starts to run in second.
I see.
But you know, that's for, you know, a Dutch team, or let's say you're presenting your country. And I think it's different here in the big leagues because I don't think everybody wants to do it. But let's say if it's like later in the inning and all that stuff. But I understand why they did it this year because of they're gonna try to wrap up as many games as they can for it to be like qualified, something like that. So I understand why they did it too. So, and with the 3 pitching, facing 3 batters minimum, I'm not a pitcher, so I don't know how to answer that part. But I mean, it's something that they've been doing, so I can't go wrong with that. So.
No, and just a quick thing, you had brought up playing for the national team, the Netherlands. That's where the Sir Didi came from, correct? That was something that you guys had all agreed upon. Can you tell us a little bit quickly about that?
Yeah, so in 2011, when we won the World WPT tournament, and instead of handed us money, they knighted all the guys that had a clean record.
Oh, that's incredible. So now whenever you go somewhere, you're introduced as Sir Didi. That's pretty cool.
Yeah, but I don't want to brag and like walk around. Hey, I'm Sir, I'm not all that stuff. You know, I'm more.
That's for other people to say. That's for other people to say for sure.
Yeah.
Well, Didi, I know we're up against it right now, but thank you so much for taking the time, and hopefully we can get as many people out there informed and enrolled into this new convalescent blood treatment program.
All right. Yes, definitely.
All right. Take care now.
Thank you. You too.
Thank you.
Hello.
Hey, how's it going? Matt Pisaccio from WMCT-TV here in Marlboro. Marlboro is a part of, or Marlboro Hospital, I should say, is a part of the UMass system of hospitals. And we've done some of the first work here with convalescent blood therapy. So it's kind of relevant for us to have this conversation today. So I appreciate you taking a little bit of time to speak with me. I only got a couple of questions for you. The first one is, in layman's terms, can you just briefly describe convalescent blood therapy and what you guys are trying to get out of these trials?
Sure. So somebody who's recovered from coronavirus has antibodies in their body against the virus, and we can get those antibodies by obtaining the plasma part of their blood. Then we take those antibodies in the plasma and we transfuse a person who either is at risk for having coronavirus because they've had an exposure or actually has the infection, but mild enough to not require hospitalization. And we're looking to see if giving them that transfusion is enough to prevent infection from happening if they don't have infection yet, or if they already have infection, prevent them from requiring hospitalization because their disease progressed.
I see. Now with, drawing out the blood, and like every person varies. So I'm sure with some people, you're going to get, a decent amount of antibodies from a healthier person, and maybe from somebody else that's not quite as healthy. The amount of antibodies in their plasma will vary. are you trying to kind of narrow down the demographic of people that you're trying to draw from?
So for this particular study, all the blood has essentially already been drawn for the most part, and it's high quality, high titer plasma that we're using, and comparing that to normal plasma that doesn't have antibodies as part of the trial. So high antibody plasma versus regular plasma, and we're going to see if we can prevent infection from happening. Now, several 100,000 people have already received plasma in the hospital, and what we found is that if you give it early enough during the hospitalization, that's when it has the most impact. So we're trying to push the timeline even further back and see, can we do it at the outpatient setting?
Now, forgive my my nativity or in this regard. I've only really known about it for a brief period of time and watched some YouTube videos here and there, like anybody would do. But I've found that in some of these videos, there are some medical professionals, at least before the clinical trial stages, that were saying that they were questioning the overall effectiveness of the plasma treatment therapy. So for somebody like me that looks at a quick YouTube video, and I'm thinking to myself, like, ooh, should I even invest my time into something that I might not be, confident that could work? What would you say to those people to help reassure them that this is something to get into?
Sure. So the data that we have so far is that if you give it to everybody, then we don't know if it works or not. We do know that if you give it early in the hospitalization, that's when it seems to have the best benefit. But we don't know. We think, but we don't know if it works for prevention. We don't know if it works for mild disease or moderate disease when you're an outpatient, and that's why we're doing the trials. So when you hear people that are skeptical about this type of therapy, doing the trial is the way to answer the skepticism, to say, does it work or not? And it doesn't make sense in my mind to argue now, does it work, does it not work? The answer is get the data and then we'll know.
Great. Well, thank you so much for your time. I really do appreciate it, Dr. Shoham, correct? All right. Well, thank you so much again. I really appreciate the time.
Thanks.
All right. Take care now.
Bye-bye.